She was completely in the clinic from the morning 9 o'clock 9:30 to evening almost 9 o'clock. 12 hours she worked dedicatedly to achieve this milestone. I want to show all of you very proudly Dr. Monisha has completed varieties of cases and there is a good amount of evidence in this.
10 implants with the prosthetic works, 30 root canals with the crown preparation, 2 veneers with the bondings, impactions, lot of extractions. Now I am very much motivated and my confidence level was very much high.
Dr. Monisha is a very good leader because she has got natural ability of leadership, like sympathy, empathy is very much for her.
I would like to thank you and this institute is very much close to my heart.
Hello viewers, welcome to Malligai Dental Academy, another testimony time. Here with me Dr. Monisha Seetharaman, and she has completed her 6 months of comprehensive general dentistry training at Malligai Dental Academy. When she contacted me last year, she said that she had a long break for her maternity, and presently she said that she wanted to pursue some training so that she can go and open her clinic in her native place. We are going to hear the story from Dr. Monisha about her mindset before this course and presently how she is feeling, what are the accomplishments she has done here. All this we're going to hear in this video. Over to Dr. Monisha.
Hello,
Vanakkam,
sir.
Dr. Monisha.
Vanakkam, sir.
How are you?
Fine, sir.
Very happy to know that you have completed a great deal of work at Malligai Dental. This is her record. I want to show all of you very proudly Dr. Monisha has completed varieties of cases and there is a good amount of evidence in this. We are going to ask Dr. Monisha. Monisha, is this a dream come true for you?
Yes, sir.
Is this giving you a lot of pride?
Yes, sir. Of
Is
course,
this giving a lot of confidence?
Yes, sir.
Please tell me, the viewers, how life has changed after you come to Malligai Dental. It should be inspiring.
Yes, sir. So I did my BDS degree in Malligai Dental College in during 2011 to 2012 batch.
Where are you from?
Chidambaram, sir. I'm coming from
Okay,
Chidambaram.
you are married?
Yes, sir.
Okay, what is your husband doing?
Anesthetist, sir.
What is his good name?
Dr. Seetharaman.
Okay, where is he working?
Malligai Dental College. Sorry,
Okay.
Malligai Medical College.
Medical College.
Malligai Medical College.
So you married a medical doctor,
Yes, sir.
and when you told him that you want to go for a course, how was his reaction?
First, he refuses the 6
Idea.
months. Yes, sir. 6 months long gap in family, sir. So after that, I convinced my total family. They are very supportive to join the course. So
Because you have a small child.
Yes, 4 years old daughter.
So Dr. Monisha is having a small baby, around 3-4 years old, and she has to leave the child to her in-laws and our mother's place, and she has to come to Chennai, stay in a hostel like a student, and she has to complete all her quota. Her quota involves a lot of work, 10 implants, 30 RCTs.
Which
Yeah.
includes 10 implants with the prosthetic works, 30 root canals with the crown preparation, 2 veneers with the bondings, impactions, lot of extractions included. That all.
She was completely in the clinic from the morning 9 o'clock 9:30 to evening almost 9 o'clock. 12 hours she worked dedicatedly to achieve this milestone. Dr. Monisha, I still remember the day one when she was here and I told her to give LA, and there was a big drama which happened. We'll ask that drama. What happened that day?
Literally, I was very panic and nervous to give the LA. Such a long gap is my fear.
So long gap created a lot of stress in you. She was frozen. She suddenly got frozen and she was totally into like zero confidence.
Yes, sir.
I just want to know why it happened. Like why so much fear after college? Like
I think it's such a long break. 5 years break is that long break.
5 long years
Yes, sir.
happened after her graduation, and it completely detached her confidence from her.
Yes, sir.
How confident are you now?
Now I'm very much motivated and my confidence level was very much high. By the end of 6 months period, I did all my preclinic works at all. 30 root canals with the crown preps, implants with the prosthetic works, extractions and impactions, many preparations and all.
இப்போ இவ்வளோ you have done ortho also,
Yes, sir.
practice
Yeah.
management, photography, and a lot of other lasers. She list is so big, so forgive us for our forgetfulness. Okay, doctor, what is your perception about dentistry after doing all this? Before there must have been some other perception. Now there it would have been an altered perception.
Yes, sir.
Please let me know the difference in your perceptions.
Life changing moment of all of us.
Okay, it became life changing
Yes,
for
sir.
you, and
Smile design.
okay, how it has affected your personal life? Like your personality also plays a role. Like once you do so much of cases and exposed to so much of dentistry,
Confident level is improved. I
uh,
can feel it.
she's telling in her from her eyes you can see that her confidence has improved manifolds, like many folds, and I can also see acknowledge her. In a year we take only two or maximum four participants. Like first 6 months there will be two participants, the other 6 months there will be another two. Dr. Monisha has completed her course in the year in this July. She is completing her course. Almost 6 7 months she has dedicated for this. And doctor, I'm very very glad that your confidence has increased, and I'm very happy
Yes, sir.
that God has chosen us to be a useful vessel for you.
Yes, sir.
Tell me, doctor, why did you choose our academy instead of anywhere else? Like, how did you come here?
Once I planned to restart my career, lots of doubt in my mind, sir. So my confidence level is very very low, and my knowledge and skills also very doubtful. So one of my friend suggested in this institute, which is named Dr. Sendil Nathan. He also planning to join the course. So we both are joined here in last January 2023.
Hmm.
So full comprehensive general dentistry course, which includes all of works.
So you're happy, doctor?
Yes, sir, very much.
So she has invested considerable, sizable amount also, and for which the family has really helped. The parents, the in-laws, the husband, everyone has supported her. And one thing I was so motivated by her experience is her dedication to the course. You know, like somehow, like her child got sick, fever, and all that. She left the child to her in-laws and her own mother, and they took care of them very well. I'm very glad that your family helped you. I want all of the members who are watching this video, your family is more important to you for your career progression, especially for a woman dentist. The family has to understand what you are going through, so you should communicate your feelings to your family members very correctly. Am I right?
Yes, sir.
Otherwise they won't understand what pain you're going through in your heart. See, if you don't convey, it will stay in your heart and it will cause a lot of pain inside you, and it will show off in somewhere else. You know, you may not directly attack or tell your spouse or your family members certain things, but indirectly this hurt of being away from dentistry, like 5 வருஷம் டாக்டர் படிச்சு nothing happened and my life is gone, almost I'm away from the profession, is there any hope for me? This is what, you know, every dentist, especially woman dentist, when they look at their life they feel நான் என்ன பாவம் பண்ணேன், I have sacrificed my life for the family, why this has happened. I have lot of dreams, you know, every woman, every man has got dreams, like especially because of the family, the responsibility, every woman
Yes.
is feeling என் கனவெல்லாம் மண்ணா போச்சு, like everything is gone, இனிமே எனக்கு hope இருக்கா அப்படிங்கிற மைண்ட் செட்டில் தான் when she came, literally she was on fire, like she took it as a challenge and did everything. Okay, coming to the second question. Slowly you started doing cases and a lot of improvements happened. Please tell me, what are the things you expected and what are the things you didn't expect at all? Like இதெல்லாம் கூட I can learn from this course.
Laser,
Hmm.
especially laser. I didn't think laser will get so much knowledge. And Venice, I am very much satisfied with the many prep and bonding.
Hmm.
So patient emotions was literally I'm seeing the after bonding is she was very much happy.
She did a nice case where the patient completely, like overwhelmed with the work Monisha has done. The case is presented here in this, and you can see the patient have got discolored tooth, and our doctor has done RCT, and then she did a veneer prep, and it is recorded here nicely how she did, which bar she used, what is the first step, second step. Completely she did digitally, like using all digital photography, digital scan, and she did temporization, how the temporaries were looking. Hannah, doctor.
Yes, sir.
So this lady patient, like she was a young girl with discolored teeth and unesthetic appearance. She got a lot of transformation, and Monisha is telling that she's so overwhelmed with her happiness.
Yes.
Can you see transformation power in dentistry?
Yes, sir. Of course.
So this motivates you.
Yes, sir.
So what's your future plan?
To open the new venture.
She wants to be an entrepreneur too. Is it only laser? Like what about problems you saw in Malligai Dental, like the staffs and other
Staff.
stuff,
Yes, sir.
like how we manage? Tell me some interesting incident which has happened, which where you played a key role.
Training program in staffness, new staffness program.
In order to improve her communication skill, we appointed her as a training officer for all the new recruits, new staff, doctors who are coming. So she started talking to them and interacting with them. It gave you
Yes,
confidence.
sir.
And do you think running clinic is easy?
No, sir.
No.
No, sir.
What is the big problem for clinics?
Mostly staff members.
Staff is the big problem. It's not the money, it's not the patient. Everyone will earn some money, everyone will get some patient, but staff, getting a good staff is something very, very fortunate, precious thing. It's very tough.
Yes, sir.
Tell me the management system which impressed you at Malligai Dental. Like, sir, these are the good systems I have never seen anywhere. And the Madri, can you tell something?
Proper medical reports, documentation. I am very much impressed.
Why
Practos and all.
Practo
Yes, sir.
software and
Preclinical photos, post operative photos and all.
so we are documenting both the pre-op and the
Yes,
post-op.
sir.
So it's painful, no? When you work properly, you have to work a lot. You can just.
But at the end of the day, you will see it's perfectly satisfied yourself.
Tell me one secret about my clinic which I don't know and you know. So this is you don't know, sir. Can you tell anything interesting like that?
All of us gossiping.
They gossip about me. That is universal, no? Okay. So gossiping.
But everywhere,
Hmm.
it's
So what do they gossip about?
good thing only, sir.
Good thing. Okay. Whatever it is, it's okay. We are all human beings, and nobody's perfect.
Yes, sir.
And see, running a show like this, with shoulder full of responsibility.
And the
One side is
responsibility.
full of
Whatever-
patient
Yes, sir.
responsibility. One side is full of academy doctors. Having a team to manage these two. It's like something very, very tough. It's like a war for me every day.
I think gossiping is very much good only
Hmm.
to talk.
So managing staff, handling office politics, these are all very, very crucial things for any organization. That's what she meant to say.
Yes, sir.
Tell me the third part of our discussion. Like, what do you think the future of dentistry is going to be? Are many dentists prepared? Those who are watching, your friends, maybe your colleagues, or what do you think you want to advise them? If you want to say something to them, what do you want to tell them?
All the rural area people also get implants
Hmm.
and also I think future is full of implant, Venice, smile
So
designing.
every special treatment which you think my village people won't be affordable, my staff are not, my people in the town are not affordable. Such patients are going to come everywhere.
Yes, sir.
So every villager, even a villager, deserves a better treatment,
Yes,
right?
sir. Yes, sir.
Doctor, uh, tell me about like dentistry before this course and dentistry after the course, what difference it made, this course?
A lot of knowledge, confident.
Hmm.
Before I am joining here, I was totally upset. Emotionally, I am very, very weak, depressed, sick. After 6 months, I learned a lot of knowledge, how to manage the staff members, management, totally management.
See, challenges are huge.
Yes,
Okay, these are all risks which will give us the rewards also. The more risk you take, the
yes, sir.
more rewards you get. And I'm very glad that God is using me in many people's lives, not only me, my staff, and other people also. And Monisha, I wish you all the best.
Thank you, sir.
And you have done a lot of work. Again, I want to tell, it's like it's like a post graduation you have done here. Okay,
Yes, sir.
your work is so good, and your attitude to patients is really good. Certain things I want to share about her. Dr. Monisha is a very, very good leader because she has got natural ability of leadership, like sympathy, empathy is very much for her. The staffs, the doctors with her, working with her, they were confiding in her very much, and they shared their problems. So she was a leader in that area. Though she may not be much confident in dental initially, but this side was very strong for her, which I found is going to be a great use or great asset for her future. Because in future, even if you don't know the work also, if you can tell somebody to do all this work, but man management, talking to people, talking to others, members, or other members are not going to be that easy, which she was already doing. And second thing is, she was so determined and so adamant to finish this course and go. She was very powerful, because she was so, like 5 years she was so away from dentistry. She was like, she was literally a rocking star in the clinic, and we really miss her. And we really want her to come and work also dentist now, assistant dentist. But unfortunately, she has to go and start her own venture. That is good for her, even though we miss her work here. Thirdly, we want all of you, those who are watching, if you are feeling stuck, that you are away from profession, you're not confident at all, even after spending so much lakhs of money in your college, please come to us for this course, which is very, very transformative and powerful, and really helpful to all of you. Because tomorrow she will do, this kind of work is not done even by specialists in colleges, postgraduates. I know specialists are doing nowadays only one or two implants, and RCTs are very minimal. Except PGs, nobody's doing RCT at all. I'm seeing testimonies every day. Colleges have to at least equip them to do some access opening, at least till premolars to BMP and all that. Because without RCT, the doctor cannot be called as a doctor. And please, I want all the colleges to stress out the importance of leadership skill and management. Please have some leadership training program and internship. Bring people from outside and tell them how to talk to, communicate to people, how to sell the treatment, how to communicate and all that. So these are the things I want the colleges to implement. I want in the college level, English. English is very bad. I want everyone, because you may have so much of talent inside, but just because you don't know English and you cannot communicate to people, people will misunderstand your ability because of your language. The colleges have to make sure, start speaking clubs, start writing clubs, start some clubs for communication skill, like Hindi and all that. People have to speak in Hindi. People have to speak in English, and even if foreign language is also there, it's very good. Monisha, I'm very glad about you in everything,
Thank you,
and
sir.
you are a good leader, and you have a very bright future ahead of you. Take lot of load, risks, and work hard, and definitely God and your family will support you.
Yes.
And my blessings are on you.
Thank you, sir.
Okay, you will be more than better than me. I bless you
Thank you,
like
sir.
that.
Thank you so
Okay,
much.
and you will learn 1,000 times more than me. That also I bless you.
I would like to thank you, and this institute is very much close to my heart. My this place is where my life changing place to. I strongly recommend to all of upcoming dentists to join here. to motivate yourself and gain your knowledge. Thank you so much, sir.
Every word you spoke is from your heart.
Yes, sir.
Okay.
Yes, sir.
And she didn't speak just from the tongue or from the oral cavity. She is speaking from the depth of her heart with lot of gratitude, lot of compassion, and lot of gratefulness. I'm also feeling it.
Thank you so much,
The
sir.
way you speak, it's energizing me. I get more demotivated too. I also feel bad sometimes. I also get upset. I also get tired. All these testimonies there, it is like amphetamine for me. People take amphetamines for performance. Like all your testimonies gives me so much of energy to spread the goodness even for many years, and people like you are going to keep coming. Okay.
Yes, sir.
Please pray for me.
Thank you, sir. Thank you so much.
And tell me one last thing. How was our prayer? How it helped you?
Prayer also.
We conduct prayers
Yes, every Wednesday.
Wednesday.
You gave me the lot of advices and motivational words to me. It's a very,
Just
very
tell one thing out of many.
believe yourself and believe God's.
Mm-hmm. Fine. Mm-hmm. So believe in God, believe in yourself, work hard, okay, have goals, work consistently.
Yes, sir. Consistency is the only key of success.
Keep doing it every
you
day.
always told me.
Yeah, if you don't like it also you have to do it. That is called discipline, and that is called consistency. Thank you so much for your heartfelt testimony.
Yes,
I'm
sir.
very grateful to you.
Thank you, sir.
I'm very grateful and thankful to God for sending you here.
Yes, sir.
And I hope me and my team has done a good job. If at all we have any mistakes or done anything, please forgive us. We need your apology also. You need to apologize us also, even like anything gone here and there, because not all things will be very perfect.
Yes, sir.
And keep supporting us through your good words to your friends.
Yes, sir.
Thank you so much. And viewers, please share this testimony to one friend at least who's going through a tough time. This will motivate them. And please put your valuable comments. That will help us to share more videos. Just watching and going is not going to help us. Your word of encouragement is very important to us. Please put at least one word what touched you in this testimony. That will help Monisha also. Thank you and God bless you.